Some individuals at risk of developing Huntington's disease will choose not to have children. Others will choose to have children who will also be at risk, knowing that they may also not be affected. Others hope for possible treatments that would be available for their children. There are many reproductive options for at-risk individuals who want to ensure that their child will not be affected by the disease. Natural pregnancy with prenatal testing. In vitro fertilization with pre-implantation diagnosis. Adoption and using a sperm or an egg donor. Every option has its advantages and disadvantages that are important to understand. A meeting with a genetic counselor will help the couple facilitate decision-making. For natural pregnancies, prenatal diagnosis is generally provided when the couple has already made the decision to interrupt the pregnancy if the genetic test indicates that the fetus has a number of CAG triplets that will cause the disease. The result is available 2 to 3 weeks following the procedure. There are 2 options for prenatal diagnosis. The first one is a biopsy of the placenta called a chorion, and is performed around the 11th week of pregnancy. A doctor does the biopsy using ultrasound for guidance. The placenta contains the same genetic material as the fetus, so it can be analyzed. The biopsy is associated with a 1% risk of miscarriage. The second option is amniocentesis and is performed around the 16th week of pregnancy. Using ultrasound, the doctor will insert a needle to extract some amniotic fluid. This fluid contains cells from the fetus, so it can be analyzed. This procedure is associated with about 0.5% or 1 out of 200 risk of miscarriage. For in vitro fertilization and pre-implantation genetic diagnosis, the couple will do routine evaluations at the assisted procreation clinic. Then the woman will begin hormone therapy that will help form several eggs at once. These eggs are collected and then fertilized in a laboratory with the partner's sperm cells. After a few days in the laboratory, a biopsy of 1 or 2 cells is carried out on each embryo. Genetic testing for Huntington's disease is performed on each cell, and only those embryos without the mutation will be kept. One of these embryos is then transferred into the uterus, and chances for implantation and pregnancy are about 35%.